Hello friends, welcome back to my channel. In this video we are going to learn about what is placenta previa, the causes and how we are going to manage the pregnant woman with the placenta previa. So let us discuss about the definition first. So the placenta previa is a condition in which the placenta is partially or totally attached to the lower segment, so uterus. Now we'll see the causes of the placenta previa. See, there is no exact cause known for placenta previa, but certain theories says that placenta previa may be because of the implantation of the blastocyst on the lower segments of the uterus, and also when the chorionic villi is developed, it attaches itself to the lower uterine segment. So it may be also because of the large placenta as we see in twin pregnancy. Next we will see certain risk factors for placenta previa. Placenta previa may occur in mothers who are said to suffer from hypertension or diabetes during pregnancy, or it may be because of advanced maternal age, or sometimes certain habits the mother's habits like smoking or taking alcohol during pregnancy or any other exposure to the teratogenic agents may also be risk factors of placenta previa. So next we will discuss about the classification of placenta previa. Placenta previa is classified into the following types. The first one is complete placenta previa. In this type, the placenta usually completely covers the internal os. And the second one is partial placenta previa, in which the placental edge will not completely cover the internal os, but it goes there and covers the internal os very partially. So that is why it is called as partial placenta previa. It is called as partial placenta previa. So in partial placenta previa, the placenta will not completely cover the internal os. And the third one is a marginal placenta previa, in which the placenta is only proximate to the internal os. It is only proximate to the internal os. And the last one is a low-lying placenta, in which the placental edge is said to be lying 2 to 3 centimeters of the internal os. Now we'll see the pictures of this classification. So here I have brought you certain pictures to show. It is in the first one you see it is a normal placenta. And the second one you see that the placenta is low lying and it is less than 20 millimeter from the cervix. The last one is placenta previa, where the placenta is completely covering the cervix. And next we'll see what is a pathophysiology of this placenta previa. As I already told you, there are certain theories suggesting that the placenta attaches itself to the lower part of the uterus because the deciduum forms and attaches itself to the lower segment. And here one more thing you have to see here, when the placenta attaches itself to the lower uterine segment, what happens is the placenta will not be able to stretch itself and accommodate. So here it compresses itself, resulting in a bleeding. So usually you can see when the placenta gets implanted in the lower part of the uterus, it starts bleeding, especially at the 20th weeks of pregnancy. Now we'll see the clinical features of placenta previa. The main clinical features are vaginal bleeding. As I told you, the reason for vaginal bleeding is As and when the fetus grows, the placenta also will grow, and it cannot stretch, so resulting in the compression of the placenta, as it cannot accommodate according to the size and the shape of the cervix, resulting in bleeding, especially after the 20th weeks of pregnancy. And the bleeding is usually painless and sudden, and it will not have any apparent cause, or sometimes, and the bleeding is very much recurrent. Next, we will see how the diagnosis of the placenta previa is done. Usually, indirect methods of diagnosis is done, that is, ultrasound examination of the placenta to confirm the diagnosis, and also to plan the management according to the attachment of the placenta. The next one is the definitive diagnosis of placenta previa. Usually the definitive methods of diagnosis is done by the palpation of the placenta on vaginal examination. But one condition is that the vaginal examination should be performed only in the operation rooms, because it may suddenly cause the separation of the placenta, resulting in heavy bleeding and also the chances of risk for the fetus. So that the definitive diagnosis should be only done in the operation room, and if at all, if we anything if the bleeding is very severe or the delivery pain starts, then we should be ready for the immediate cesarean sections. So that is why this definitive diagnosis is a palpation of the vagina is usually done in the operation rooms. Management mainly focuses on hemodynamic stabilization of the mother, especially by giving IV fluids, and also if the bleeding is very heavy, we need to replace the blood with the help of transfusion, blood transfusion. And continuous fetal monitoring should be done, because when the bleeding is very heavy, suddenly the fetal heart rate will drop down. So continuous fetal monitoring is necessary. And also we may sometimes administer the steroids, so that it will be helpful if we are planning for the premature delivery, so that it helps in the fetal lung maturity. And if at all, if the fetus is mature and ready for the delivery, then we can go for the cesarean section. If at all, if the baby is still premature and not viable for delivery, we should ask for the mother to take a complete bed rest, and usually it is done on an outpatient basis. Okay friends, so till now we have seen what is placenta previa, the classification, the diagnosis, the management of the placenta previa. Thank you for your patient listening, and if you like this video, please do like, share and subscribe. Thank you.